we're back again. You're listening to So Much More, a women's health and wellbeing program. In the studio with me, I have got Chris Widdicombe, and she is the maternal and child health team leader for Greater Shepparton City Council. And we're continuing our discussion about the different services that are available for maternal and child health. How do parents hook up with the services? Are they doctor referrals or just walk-ins?
Every time a baby's born in the state of Victoria, the hospital where the baby was born or the birth attendant is required by legislation to send a notification of the birth to the local government area where the mother lives. So that's how we get most of our families. We get a birth notice from the hospital the baby was born at. If families, and we then get in contact with the family to organise that first home visit. If families move into the area, then generally what's needed is for them to contact us and let us know that they'd like an appointment, because we don't know they're here until that point. So, yeah.
Why did you become a maternal child health practitioner?
My experience in nursing up to that point had been in paediatrics and in midwifery, and I suppose I enjoyed working with children and their families, but I liked the idea of a role where the contact was more ongoing as opposed to nursing a child in hospital for a few days and then they would go and, you didn't always know what the outcome for that child or that family was. So I liked the idea of the fact that it was ongoing and you had a relationship, over time with a family. And I also think that maternal and child health nursing is a very family-friendly area of nursing for staff to work in, so having regular hours, not shift work, and I think council's a very flexible employer like that. I would say that's one of the things that the majority of my staff really enjoy about their work.
I can see why that would be appealing.
Yes.
Very, very much so. What do you find most rewarding about your role?
I think being a part of making a difference for children is really rewarding, and seeing them grow and develop, and also along similar lines, watching their parents develop in their parenting role. It's a real joy seeing parents with their second or third child and just seeing how relaxed and confident they are and how much they've grown as parents and how much they're enjoying it. It's really nice to be a part of that. Mm.
What sorts of challenges do maternal child health practitioners face? Or can you face?
I think our nurses face a lot of challenges in their role. So we're not a mandatory service, and so some families don't attend regularly, and that can be for a variety of reasons. But it means that it's up to us to try and engage with them, which means trying to understand what the barriers for them attending are and trying to provide flexible models of service which will meet their needs so that the service is accessible to them. And that can be challenging with the funding constraints that we have. I also think that it's fair to say that now we're seeing a lot of families whose situations and needs are a lot more complex than they used to be. So issues like substance abuse, homelessness, mental health difficulties, family violence, teen pregnancy, significant issues for families to work through, and now we're tending to see families where there'll be a cluster of those things, not just one or the other of those, but multiple issues happening for them at once.
That must be very challenging to deal with, the clustering of issues.
Yeah, it is, because you need to, I guess, at any point prioritise what the most important issue for the family is, and that's where having a good rapport with families and a strong relationship with them is really important, because we need to really effectively work together.
Yeah. Why is it important for parents to use the service?
We know that when children access quality universal health and education services, they have better outcomes, and it's as simple as that. We also know that, as I said before, getting things right for children in the early years has a significant effect on their life trajectory. There's a lot of evidence around brain science that development with the first 3 years of a child's life is pivotal. So if we can put things in place at that early stage to manage anything that's happening for the child or the family, then it stands to reason that by the time they get to school, hopefully there'll be better outcomes for them.
So which other service providers would you make referrals to?
We often refer to quite a range of other services and professionals. So, for example, general practitioners, paediatricians, lots of allied health services like speech therapists, OTs, physiotherapists, dietitians, optometrists, audiologists, and we also refer to a number of family support agencies like Primary Care Connect, The Bridge, Child First, those sorts of organisations that offer a range of support to families.
How many children or parents or families on average would you see each year?
So last financial year we had a total of about 5,500 children enrolled in the service in Greater Shepparton. I think there's about 850 babies born last financial year. We did a total of 7,624 key age and stage visits, and the total number of visits, so including additional visits for families, was nearly 10,000, and then there was a bit over 2,000 phone consults on top of that.
So you're very, very busy.
Yes, it's a lot of visits when you add them all up.
That's fantastic. Are the services zoned, and are they easily accessible by bus or public transport?
So in the first instance, birth notices are zoned to the centre nearest to where the mother resides. However, families are able to attend wherever they like. So if they want to attend another centre, we just transfer them to that centre. Some families elect to do that, for example, if they've moved but they want to go back to the centre that they used to attend because they've got a good relationship with the nurse there, and that's fine. Or they may attend a different centre if they want to attend a centre that's co-located with other services that they use, like kindergarten and childcare, because that can be really convenient to have an appointment prior to dropping kids off or after they've picked them up. So that works well for a lot of families. In terms of buses, some families do use buses. Well, I would say we probably don't find that parents do that a lot. It's probably more common that they would walk. And so we try and zone streets to centres so that families can do that. And if they're having difficulty getting there, then we'll often look at whether there's a home visiting option that we can put in place.
Yeah. How easy is it to get an interpreter if the client doesn't speak English?
We use interpreters very often, so language barriers can be an issue for a lot of our clients. And I'd say it's easy in the sense that we have an agency that we can book interpreters through, and that's funded by the Department of Education and Training. So we're usually always able to secure a booking when we need it. Probably the greater difficulty is that we're often unable to get an on-site interpreter, so in those situations we use a phone interpreter, and that's a lot more difficult for the nurse and the client because we're generally using mobile phones on speakerphone, and when you have a couple of older children running around and playing with toys and things like that, it can be quite difficult to hear. And I think it's also more difficult for the family because it's more difficult to develop a rapport with the interpreter when they're not in the room, and they are fairly integral to the flow of information. So when you have an interpreter sitting in the room, everything still has to go back through them, but you can see people's facial expressions, and it's a lot more engaging, I think, for the client.
Yeah. This is a trick question, would there be any potential for interpreters to be employed in the service, or would there just be too many
I think there's probably just too many and too many different languages. So that's why it's set up the way it is. So we use the VITS interpreting agency, and most times they can source an interpreter in the language that we need. But it does have its difficulties, and it's difficult for the nurse too. So for example, we had one the other week where the nurse had to wait for 15 minutes to get put through to the interpreter, and then her phone dropped out after about 15 minutes, so then she had to try and rebook another one, and it's very disruptive and disjointed for the family, I think, when that happens, and she felt uncomfortable as the professional that it wasn't as good a service as she'd like to be providing. Yeah.
What kind of advice do you commonly give to parents?
So the advice that we most commonly give, I would say, reflects the framework that's set out by the Department of Education and Training, and it has a strong health promotion focus. So it covers areas like SIDS and safe sleeping, general safety, learning and development, language development, feeding and nutrition, sleep, quitting smoking, women's health, immunisation, dental care, and I guess letting parents know about what's available in terms of playgroups and kinder. But in reality, there will always be a range of topics outside that sort of set program that come up about infant and children's development and their health and behaviour. So it's really, I think every visit we have with a family probably the most important thing for that visit is what they actually want to ask about, whatever's concerning to them at that visit.
What time of the year usually has the most new babies born?
Well, I looked back over the births for each month for the last 2 years, and there's actually no one month that has the most. So in 2015, there was the most babies were born in March, followed by December and then June. And in 2016, it was January and then March and February. So I guess you could probably say we tend to have more over the warmer months. Yeah.
Is there any other advice or information that you think is important or relevant for our listeners to know about?
Only that I think if anyone who is listening has any questions about receiving the maternal and child health service, that they just need to call us at council. So the number's 58 329 312, and if they're from an area outside of Greater Shepparton, we can organise to transfer their records, but we have a central booking number, which is that number, and so our admin staff member can usually talk people through booking appointments and organising their records to be transferred if that needs to happen.
And can I get you to say that number again, pretty please?
It's 58 329 312.
Excellent. Thank you very much, Chris, for coming in.
Not a problem.
That was Chris Widdicombe, the Maternal and Child Health Team Leader for Greater Shepparton City Council. And if you need more information about a maternal and child health nurse or visiting one, you can call them on 58329312. That's 58329312. Or you can visit the Greater Shepparton City Council's website for other links, and that is greatershepparton.com.au. Thank you very much for listening. I hope you enjoyed the program today. If you want to give me some feedback, you can. I have a Twitter account, So Much More Radio. You can join me on Facebook, www.facebook.com/SoMuchMore. You can email me, somuchmoreradio@gmail.com, or you can send me a text message, 0404 600 856. That's 0404 600 856. Thank you again for listening, and I will talk to you next time. Produced with the assistance of the Community Broadcasting Foundation Australia.